Hello and welcome to the Here For You podcast. In this podcast we explore topics of psychology, philosophy, mental health and therapy, as well as the intersections between these disciplines. If you'd like to support the show, please visit the Patreon page. The link for this can be found in the show notes of the podcast. Also stick around to the end of the podcast to hear about more details of workshops, different ways you can support, and upcoming shows as well. Have a good listen. Today we're going to be talking about adverse childhood experiences, or ACEs, and we're going to be exploring a little bit about what ACEs are, the literature around what they mean, about prevalence rates, and then we'll talk a little bit around the impact of ACEs or the potential impact of ACEs on both mental health, physical health, also kind of consider that in terms of social health as well. And then we'll explore a little bit around clinical implications of ACEs. So how can we work with diverse childhood experiences, both in terms of individual clinical work, as well as broader societal perspectives of how society might work with ACEs, a way to sort of minimize them perhaps, as well as a way to work with the current impact that's having on various health outcomes. Okay, so what are ACEs? So ACEs are broadly defined as a set of harmful experiences a child may go through during their development. Within the literature, it's often divided into two separate types of adversity, one being direct child maltreatment and the other one being household dysfunction. The concept of adverse childhood experiences, although it's existed in some sense for a long time within clinical work and clinical understanding, the actual term and current understanding that we have of it originated from a study within the US in the Center of Disease Control and with the company Kaiser Permanente in 1995. The most common presentation of ACEs, both within the literature and within the clinical context, is within the ACEs questionnaire that was developed from that study. The most common presentation of this is 10 ACEs, although it can vary between 8 through to 17 or 20 different ACEs. I'll be focusing on the 10 ACEs as outlined in the majority of the literature and within clinical work currently. Okay, so what are those 10 ACEs? Those 10 ACEs that appear within the ACEs questionnaire, they're defined as physical abuse, sexual abuse, emotional abuse, parent substance misuse, parental incarceration, having a parent in jail, parental mental health problems, exposure to domestic violence, physical/emotional neglect, and parental separation/divorce. Some controversies around these 10 ACEs and the inclusion-exclusion of things. One of the original controversies was around exposure to domestic violence. Within a lot of and still currently within a lot of the ways that the ACE questionnaire is structured and the language in it, it talks about the domestic abuse perpetrated against a mother in particular, or a female member of the family. And it doesn't allow for the possibility of exposure to violence in a domestic abuse context or domestic violent context of a male being the victim. It's since been broadened up to include that, but the traditional questionnaire only addressed the idea of male to female violence. Another one is that's often kind of picked up in clinical work and within literature is the absence in the ACEs research or in the ACEs questionnaire of parental loss through death. What some clinical reports say and what some clinicians engage with is they'll take the item of parental separation/divorce and they'll widen that to parental loss. So that sense of, parental loss through separation or parental loss through death. but it remains a controversial issue whether parental death should classify or not classify as a adverse childhood experience, at least formally within the research and within the ACEs questionnaire. Okay, so we talked a little bit around what ACEs are, or one way to conceptualize adverse childhood experiences, and again, today we are focusing very formally on the ACEs questionnaire and the measure that exists. A way of thinking about ACEs or adverse childhood experiences is to think about it in terms of a broad idea of difficult experiences that a child may go through in their development. But just focusing in on that kind of questionnaire, what is the prevalence, the kind of global prevalence? So within a recent study, the most recent one that I could find in the literature by Magdagan et al. in 2023, their research included cross-cultural considerations. It examined multiple different studies within different populations, and what that study concluded was that of the sort of global population that the papers that they considered included, they found that those that experienced no ACEs totaled about 40% of the population, so 39.9%. Those with one ACE was 22.4% of the population. Those with two ACEs, 13% of the population. Those with three ACEs were 8.7% of the population. And those with four or more ACEs formed 16.1% of the population. Now, that sort of four or more ACEs the significance of framing things as four or more ACEs will become apparent as we explore the concept of the impact of ACEs. And often within the literature, it's framed that way. It's framed with four or more ACEs being significant in terms of potentially negative health and social outcomes for people who identify as having four or more ACEs. Okay, so speaking about broader prevalence, what's the impact? What's the potential impact, both on a physical health level, on a mental health level, and on the wider social implication? I think it's important to consider ACEs across all of these domains. And the literature has a lot to say around all of them, around both physical health outcomes, mental health outcomes, and social outcomes, which I think is a really interesting aspect of the ACEs research, is that it has always been grounded in both physical and mental health statistics. I think actually it started more within the physical health realm. There are some public health experts who currently believe that actually the most impactful public health crisis that we're facing in contemporary society is adverse childhood experiences, and actually if we can understand this area more, we can help to address many of the challenges that we're facing on broad public health concerns. So it's really a big area of concern across the board, not just in terms of mental health, but also physical and social health. Okay, so the impact of ACEs. So very broadly speaking, the impact of ACEs is that the more ACEs an individual has, the more likely there is a correlation between negative outcomes, and again, across physical, mental, and social health. So to kind of talk about that a little bit more, the Magdagan study, they concluded that those diagnosed with a mental health condition or struggling with substance abuse and addiction, and those who are unhoused, so those facing homelessness, have a higher prevalence of four or more ACEs. So across all of those measures, people with mental health conditions, people with substance abuse challenges, and people who are unhoused, all have a higher or four or more higher prevalence of those 4 or more ACEs. And on the other side of that, what they actually found was that not only were people more likely to have 4 or more ACEs, but actually they were less likely than the general population to have no ACEs. So even if they didn't have 4 or more ACEs, they were very unlikely to have 0 ACEs within their experiencing. And I think that's a kind of key finding. Often that tends to be missed within the research. You focus on the 4 or more, but actually not necessarily thinking about the prevalence of below that within certain populations. So right there we have evidence to sort of say about the impact of having 4 or more ACEs on sort of mental health conditions. We talk about that within substance abuse, and we also talk about that in terms of a social challenge in terms of those who are unhoused having a higher percentage of those ACEs. What's also found is those with a chronic health condition, such as heart disease and obesity, are also found to have a higher prevalence of 4 or more ACEs as well. And I think that is significant as well. So across all of those measures of social, mental and physical health, there is a higher prevalence of 4 or more ACEs. Okay, so I think it's one thing to talk a little bit about what the impact is, and it's interesting to think about that, but I think it's also important to consider or to think a little bit around why we might be seeing those impacts. Why is it that those with 4 or more ACEs have higher negative outcomes across all of those measures, across all of those domains? One argument that's often put forward is the idea that having multiple ACEs within childhood puts a child into a state of chronic stress. And this state of chronic stress impacts upon both brain development and other bodily physiological development, in terms of the impact of chronically raised heart rates, of chronically high adrenaline and stress hormone release, and that this has in itself an impact upon both mental, physical and social health. So in itself, the chronic stress state that a child may be exposed to through multiple adverse experiences leads to a impact upon brain and other bodily development, which leads to later mental, physical challenges that we see within the research and within the clinical environment. Another sort of idea here is that it's not necessarily the ACEs in and of themselves, but actually there's a mediating factor of people having the experience of ACEs, which then might lead to engagement in riskier behaviours, things like poor diet, things like substance abuse, which may lead then to the negative mental, physical and social health outcomes that we see. You could see how people might be engaging with things like poor diet or risky behaviour through maybe a lack of parental engagement and education around involving around diet or around not engaging in risky behaviours. You could also see it as a form of emotional, an attempt to emotionally regulate chronic states of stress, which then might lead to the negative outcomes that we see. For myself, I am inclined to say it is probably a mix of both of these things. It is probably a mix of an inherent directional link between adverse experiences and physical, mental and social challenges that we see within the ACE population or higher ACE population, and also the mediating impact of engaging in potentially risky behaviours across both physical and mental and social outcomes. a really interesting area of research that is being developed, has been developed and has a lot to kind of say really around the biological, the impact of ACEs on biology, on physical well-being as well as mental well-being, is a field called psychoneuroimmunoendocrinology. It's a very, very long word, which highlights, and I'll say it again, it's a psychoneuroimmunoendocrinology. This is an area of research that focuses on that psychological link between adverse experiences, psychology, and other health-related challenges and diseases. Very interesting area of research that I won't talk too much about today. More just wanted to signpost it for anybody who is interested in finding it out more. So that is psychoneuroimmunoendocrinology. Type it into Google or Google Scholar. Some interesting papers around that area. And again, that area partly highlights why we might be seeing some of these impacts of adverse experiences on later negative outcomes with people of higher prevalence of ACEs. I think there's also an impact here to consider around repeating patterns of parenting. So parents who have had more ACEs within their childhood are more likely to engage in potentially negative parenting practices that may incur the repeated pattern of ACEs. And I think this is an important thing to kind of consider, the repeating sort of patterns within generations, perhaps, of abuse being passed down and challenges of adverse experiences being passed down through the generations. Maybe a link there with a generational trauma being carried, although that's a much bigger area of consideration. Yes, and I think important to be critical around this as well. Other research has found that actually it's not necessarily the adverse experiences in themselves that leads to the negative outcomes that we see in those with higher ACEs, but actually there's a mediating factor there in the ability for somebody to emotionally self-regulate. So there is some research out there to indicate that actually it's not maltreatment in itself or not the adverse experiences in itself, but actually whether somebody has developed the ability to emotionally self-regulate as to whether they will go on to develop the negative mental, physical, and social outcomes that we see. Okay, so talked a little bit around what ACEs are. We talked about the impact, why that impact might be. Again, just touching on some of these things, there is much more research and evidence out there. And now moving on to clinical application. So thinking about working with ACEs both on an individual level, but also on a wider sort of systemic social perspective. So very broadly speaking, working with ACEs. Talk about a trauma-informed perspective, taking a trauma-informed perspective in our work. I think that can be the case both within individual clinical work, but also in terms of a wider social perspective. A trauma-informed perspective can be taken by any organisation. It's the ability to consider trauma and hold information about the potential impact that services might have on those who have experienced trauma within their lives. I will be exploring trauma-informed care and the trauma-informed perspective in a later podcast episode. However, this is just to say that I think a trauma-informed perspective is probably a very useful tool to engage with both individually and wider systemically when working with people who have had higher ACEs. I think there's also something about working with parents to help reduce the prevalence of ACEs in children. So something around wider social education. often within literature, there's a lot of focus on children in themselves, but actually maybe we can think about the parenting practices and raise awareness of the impact of some of these negative experiences on later development, as well as maybe getting parents in touch with the own potential ACEs they may have experienced, and working towards maybe rewriting the script for their children. So something around wider social education around what ACEs are, and working particularly with parents. I think maybe there's even an ability to work more targetedly or specifically with what we might kind of term at-risk groups. I use that term very hesitantly. I don't think it's always the nicest way of kind of phrasing people who have gone through difficult experiences. I guess by at-risk groups, I might mean people who might have quite a lot of ACEs and may be identified as already kind of experiencing various physical and mental health challenges related to that. And by targeting, I mean maybe working with them if they're parents to help mitigate the impact of passing on ACEs. I think this also extends not just to parents but also to the wider public. I think from a public health perspective, there probably is an importance, or a crucial importance, for raising the awareness generally within the public of the impact of ACEs, as well as within healthcare professionals. So that sense of across all healthcare, being aware of the impact of ACEs and how this might be potentially screened for within clinical environments to raise awareness and of the impact that this may be having on patients or clients that are being seen, as well as from a wider social perspective, people considering the impact of their early experiences on their current well-being across both mental, physical and social well-being, that is. I think working from an individual perspective, although this may also translate to a wider systemic perspective, I think there's something about empowering clients to emotionally self-regulate and empowering clients with emotional self-regulation skills. I think that can be hugely key and may address some of the controversies within the literature about why the impacts may be. As mentioned earlier, there is the idea that actually it's about emotional self-regulation rather than ACEs in and of themselves. So maybe there's something here about if we can empower the clients that we're serving, the wider population perhaps as well, to engage in useful emotional self-regulation skills. This may help to mediate some of the impact of the 4 or more ACEs that we see on various outcomes. Yeah, so I think focusing on emotional self-regulation skills and empowering clients to engage with this, and maybe also pass that on to engaging with parents to help emotionally regulate their children, but also encourage their children, empower their children to emotionally self-regulate themselves. I think there's also something that this research brings up, and that today's podcast to me has really highlighted, and that is that the need to recognize the mind-body connection and its relationship. There's a lot more research out there about this, and it's a much emerging field. I think that it's probably useful within the consideration of ACEs to hold that in mind and hold how these seemingly dualistic aspects might actually be quite tied up together, and conceiving of them maybe as very similar or even the same system. Okay, so today we've explored adverse childhood experiences. We talked a little bit about what they are. Very broadly speaking, they are the adverse experiences that happen in childhood, that can happen in childhood. We talked about that being around forming around the adverse childhood experiences, or ACEs questionnaire, which outlines 10 questions or 10 types of ACEs. And that actually the most challenging outcomes that we see are with 4 or more ACEs. We talked a little bit about the impact that this has on both mental health, on physical health, and on social well-being. We also talked a little bit about why we might see those impacts in terms of children being placed into a chronic state of stress and the impact that that can have in itself, as well as the impact that this can have on engaging in other behaviours or other activities that may lead to social, mental and physical ill health. And then we talked a little bit about working with ACEs, taking a sort of trauma-informed perspective, raising awareness, empowering clients to engage in emotional self-regulation work, and recognising the mind-body connection. Thank you for listening to the show today. If you're interested in supporting the show, please do visit the Patreon link in the show description. There's various different packages involved in the Patreon page, right from just supporting the show to further access to additional resources and access to workshops. You can also visit us on the website hereforyoucounselling.com. That's hereforyoucounselling.com. Again, a link within the show description. If you'd like to book onto additional workshops, there's also a link to the Eventbrite page in the show description. There's a variety of in-depth discussions around lots of the topics that we talk about in the show today. Thank you for listening. Hope you've enjoyed the show.